We have crisis management, which is a 10-bed detox, medically managed detoxification unit, and we also have a 30-bed rehabilitation unit, and hope to expand those services, because I think the goal for people is to have a medical home where you have a facility that will take care of all of the healthcare needs.
What about Community Action Organization of Erie County?
And we're the War on Poverty agency for our county. Lyndon Johnson in the Great Society programs in the mid-1960s developed these community action agencies. Each one in every county has one, and they all have different names, but they all are funded by the same funding source and have the same basic regulatory structure. We operate the Head Start programs, emergency services, food pantries. We operate a medical clinic for methadone or opiate addicted persons. We have housing programs. So we do a wide variety of things that serves that entire class of low income and poor people in our county. And so health, education, housing, those are like critical issues. Food, emergency crisis services, and so on are the critical issues that our agency works on. And so we work with our partners in the health industry to ensure that low-income people have access, and we just do whatever we can to be the glue, to bring these things together so that access occurs for that population.
Okay, and the Community Health Center of Buffalo?
We're a fairly qualified health center. We get subsidized by the federal government to provide services for those that are uninsured and underinsured. It's the mission, and there's about 1,500 throughout the country. As a matter of fact, both candidates talk about community health centers because it has been one of the most successful, cost-effective, quality health systems that we do have.
I have a question. If we were to look at the ranking of the health of Americans and compare them with other nations, we're at 30-something, 36, 34. Is our weakness what we're doing in areas like Buffalo?
The weakness, one of the weaknesses is the fragmented health system. You don't have primary care, hospitals, private, public health institutions that all work collectively together. We work actually as independent silos. The good news is that we're all, because it's an economic crunch, and the fact that the need is so high for health care that we're now starting to talk, particularly in Erie County and Buffalo, the hospitals, primary care, we're all starting to talk to see how we can make our health system more user-friendly for everybody, for all the systems. So one of the things I look at for a federally qualified health center, I feel I'm a broker and a facilitator to make sure that our patients get the services they need when they go to other systems. So we begin to take the cost of, now we will send you to the hospital for appropriate reasons and appropriate services and specialties, because now we have a very collective and comprehensive system versus a very fragmented one. So if I send a patient over to one hospital and say, I don't take them because we don't take this insurance, we now have to work as a team to make sure that whoever we send, you will be able to take, because we worked out all those bureaucratic issues.
Yvonne makes a very good point. I think part of the solution is working together collectively, and I have to say over the last year that we're really doing well in that area. As an example, Sheehan Health Network is a small network, and we can't operate alone. We need to be a part of a system to do this. We've reached out to Kaleida Health, and Kaleida Health is actually going to operate a dental clinic that we will open up within a couple weeks. We've reached out to ECMC, to Roswell Park. Roswell Park is looking to help us do some cancer screening for our patient population. Different foundations like the OSHI that's helping us fund a lot of the initiatives that we need. So they're coming together, and I'm so pleased Blue Cross Blue Shield, one of the payers, is working and supporting Sheehan on a lot of initiatives, such as the Emerson Young Clinic. This is a clinic that's right in the peri-housing and where we're taking health care to that area, because we know that access in terms of transportation is an issue.
So we're seeing that in this market and others around the nation that entities are working more closely, and yet many in America say that America's health system is essentially broken and needs to be totally revamped. When we come back, we'll talk about that very topic. We're back with Medical Matters, talking with some experts here in Buffalo about care to Americans. My question to you is this: there are those who say that America's the most healthy economy in the world, even today, and above every other nation, but our health care is ranked in the mid-30s. Is our medical care system of delivery of primary care broken, or do you think it's okay and some minor changes might do?
Certainly, I don't think minor changes will get this done. One of the things you heard we were talking about a minute ago is that our collaborations are creating a single point of access, meaning that if you come in through a community health center or you come in through Sheehan, you can be triaged to other providers who are not economically connected to you. And so we can access services that way. But what that also then demonstrates is that our ability to be able to provide the services that ought to be accessed through that triaging, we start to see these huge holes, in our system. Our holes in terms of the ability for people to pay for those services, holes in terms of where you have to go to get those services. So our system is not united. So we're working hard to collaborate with each other, but we don't really have a unified system that ensures that everybody who comes in can be taken care of all the way through their health needs, all the way through closure. And of course, there's never any real closure to your health needs, because as long as you live, you're going to require some health services. So we have to figure out a way to get that done. Let me just give you a quick problem that we have to solve. We have an STD, a sexually transmitted disease problem in our society. It's extreme. 25% of all of the girls ages 14 to 19 in the society have at least one active infection.
Nationwide.
Nationwide. But in some communities, particularly on the east side of Buffalo, in certain neighborhoods on the east side of Buffalo, those numbers might be 50% or 60% of the girls in that population have one or more sexually transmitted diseases. Now, why is that a problem? Well, the consequences of those diseases turn into infertility, they turn into organ failure, they turn into a lot of other kinds of issues that are very, very expensive to solve, not just in terms of the cost of care, but the cost to the society. This person not being able to be a productive person in our society. They can't even go through education when they're going through these kinds of health complications. So we have to address this as a state or a federal interest. In other words, we have an interest in seeing to it that everybody has quality health care. Just like we have an interest in seeing to it that everybody gets an education, we have an interest that we have bridges that work, that we have roads that work.
But there's the rub. There's the rub. Go ahead.
I figured I'd start that out.
We need to start with a basic fundamental belief that everyone deserves health care, a certain level of health care, and I don't think we're there yet. I think people will say, I can take care of myself, why can't they? So we've got to solve that first before we can begin to implement, make changes, or do anything else.
The way it has been looked at historically in the United States is that healthcare was perceived as a consumer product, not a human value, not a shared societal need, but kind of like a boat. Or a second home, or even a new suit, or a car, or televisions, that type of thing. If you want to buy it, great. If you don't, not. What's wrong with that approach? What's wrong with looking at healthcare as a consumer product?
Well, the part that you triggered for me is the logic to that, because with that type of logic, we don't even look for the best medical care, because we don't see it as a human value and a human right. So we will look for a car and spend time researching a car more so than we will our health and who is going to actually treat us.
And where this starts to make some sense is, as Dr. Bill Keck, who writes textbooks on public health policy, says, is that a public health policy for a nation has to include care for all. And if you have a system that's strictly free profit, free enterprise, there's going to be a lot of gaps. And we were talking about those gaps earlier in the show. But that to address care for the whole nation, you have to provide care to the whole nation, and that means easy access to care for the whole nation. And that's not the way it is right now. The truth of the matter is that a lot of kids in lower income families, and adults too, don't see a doctor on a regular basis. They only go to the hospital when they absolutely have to. And that's how we ended up 36th about in world health, in a nation where we should be doing better. For more Medical Matters television shows, go online to medicalmatters.tv.